We begin our program today with one of our regular visits with Dr. Mustafa Hirji. As we get more comfortable moving on to a more normal way of life, it's important for us to remember that COVID is still with us. And Dr. Hirji, that is part of your messaging over this last little while.
Yeah, absolutely. As much as I think we all want this pandemic to be over after 2 years of difficulty, it isn't. The good news is that we're in a new phase of the pandemic. A lot of the really intense things, the restrictions on our social life, the limits on businesses operating, those are probably no longer necessary, at least until another variant shows up. But it doesn't mean we can drop our guard completely because we're still in the final phases of beating back this pandemic. And I think the key things that we need to keep doing is make sure we're up to date with our vaccinations, make sure that we're wearing that mask when we're in indoor spaces and in crowds in the outdoors. That's going to keep us safe and keep others around us safe. And make sure that if we do get sick with symptoms with illness, we stay home, we use those rapid tests, and we do our part not to spread infection to others, especially people more vulnerable.
Do we hesitate using the W word, the wave? Are we in the sixth wave right now?
I think we're absolutely into a sixth wave right now. We're seeing, for example, if we're looking at healthcare workers who are off, there's more healthcare workers off right now than in any previous wave. So that's one measure of how bad it is. I think we have more children and people in our school community sick than in any previous wave. And that's partly because there's fewer protections for them than they've had in previous waves. So we're absolutely seeing a very high number of infections right now. I'll make, one other note here is that our hospitals, Niagara Health was reporting that they are up to 90 patients hospitalized who have COVID-19, which is what they had at the very peak of the third wave and just short of the 92 they had at the peak of the second wave. So this is turning out probably to be actually worse than those two waves in terms of people being hospitalized.
Dr. Hirji, at the same time, we're hearing that most people right now who are contracting COVID-19 are contracting the Omicron variant, which has led to milder symptoms.
Yeah, so the Omicron variant, it's been here since January. We're dealing with a new subvariant of it right now called BA2. It's probably part of what's responsible for symptoms being a little bit milder. 30%, 40% of people are going to probably have milder symptoms because of it. More important than that, though, is actually people having vaccines and particularly third doses of the vaccines, because we did a lot of those over the last few months. And that means that, unfortunately, if people do get sick with COVID-19 still, they have a lot of protection, and that protection is basically beating back any kind of severe illness. It's ending up being a bit more like a cold for them, which is the really good news. And that's why I really want everybody else who has not yet got their third doses, or perhaps even yet has their first and second doses, to make sure to go out and get those, because that's what's going to make sure you either don't get sick, or if you do, it's going to be just a very mild illness. And that's partly why we can be in this new phase of the pandemic where we have much more mild illness.
Niagara has also rolled out a fourth dose to those 60 years old and older. Will that be coming down to the younger age groups?
It's possible. I'm not anticipating that's going to happen anytime soon. The science on the fourth dose is actually relatively weak at this point. We've seen that, we know that older people 80 and above, people in long-term care homes are highest risk of having those severe outcomes of passing away. So this is a bit more of a precautionary vaccination to make sure that those who are at greatest risk have that little bit of extra protection as we go through this wave. It's not necessarily because we've seen that there's a true, absolute need for everybody to get it right now. The other thing to note is for the younger age groups, in many cases, they don't even have their third doses yet. And it's not really important to worry about a fourth dose for them until we get their third doses. My advice is if you're 80 and up, get that fourth dose. But if you're other groups, it's really more of an option for the 60 to 79-year-olds. And for the people who are 12 to 59, make sure you get those 3 doses. That's what's really important for you right now.
As we're not currently seeing large-scale vaccination clinics or even large-scale testing, public health is moving back to doing some of the things they did back before March of 2020. Am I correct?
Yeah, partly that's about less people being vaccinated right now. We did 500 yesterday, so it's not an insignificant number, thankfully, who are coming out to be vaccinated, but we're not seeing the 2,000 plus that we were seeing at some points in this pandemic. The other part is that the province, because they're not doing testing, we can't really do contact tracing because we don't know who all the cases are and we can't chase down their contacts. And that's really freeing us up to reprioritize to do some of the work that we've not been able to do the last couple of years. Key amongst that is, of course, vaccinating against everything else that we used to vaccinate school children against. With schools being closed for big periods, and of course, us being occupied with COVID-19, we haven't been able to do that vaccination. We're trying to catch up on screening people's dental health in schools as well to make sure we protect children from that. And there's lots more that we need to get back online in the coming months.
We saw Ontario lift the mask mandate, Joe Biden doing the same thing in the United States. Is this the right thing to do at this period in time?
Yeah, I don't think it is. And in the US, there's really more state governments than the federal government under Joe Biden who did it. And likewise, here in Canada, it's largely been provincial governments. They've been the ones lifting the mask mandates. We're into a sixth wave, as I talked about. Our hospital numbers are basically, meeting what we were at the third wave and about to meet what we were at in the second wave. I don't think this was a good time to lift the mask mandate. It's something that's easy for us to do. It doesn't disrupt our ability to go out and enjoy all the different amenities in life. It doesn't restrict our business from operating, but it does keep us safe, and it does make sure that people around us, especially those more vulnerable, can stay safe. And so I think we should have kept the mask mandate. My recommendation is the province should bring it back temporarily while we go through this wave. And I strongly encourage everybody to keep wearing your mask voluntarily in absence of that mandate right now.
With the summer coming and nicer weather, we can spend a little bit more time indoors as well, which is a good thing. We won't need the masks as much on the outdoor situations.
Yeah, definitely as we get to the warmer weather, and we've had a bit too much snow of late, so I'm hoping this is going to finally get past us so that we can actually be outdoors enjoying the better weather. Being outdoors, of course, lots of natural ventilation, which means any virus people might be breathing out is just blown away and it's not going to be infecting others as easily. The heat is a natural disinfectant. The humidity means that aerosolized, droplets with virus in it, they will have the moisture conglomerate around them, become heavier droplets and fall to the ground so they can't stay afloat in the air and infect others. Just makes us all the more safer. And I think hopefully we can have a long and warm summer to minimize any risk of COVID-19.
And let's hope it comes soon. Dr. Hirji, thanks for joining us today.
You're very welcome.